Welcome to Vital D. All we do here is to bring health tips closer to your nearest doorstep. So today we'll be discussing one of those important conditions that affects the life of a man. Because sometimes as a man, once you're not doing the work of a man in the other room, no matter how much you are trying, how long you are trying to put things in place, once you fail to perform the role of a man in the other room, you might just be a laughing stock in front of those your colleague or ladies out there. So please, today we are going to talk about a very important topic, premature ejaculation, because these are one of those conditions out there that a lot of guys are facing, and sometimes they don't know how to relate it, and sometimes they don't even want to talk about it because of the embarrassment they feel. So today we are going to discuss extensively what can be causing premature ejaculation, what it is, and then the home remedies we can do at home to treat this. Welcome once again to Vitality. So what is premature ejaculation? Premature ejaculation is just a sexual, how will I put it? Premature ejaculation in a layman's term is just a sexual dysfunction in which a man ejaculates sooner than desire. You understand? Basically, once you ejaculate within the first 180 seconds as a man doing sexual activity, that is premature ejaculation. No matter how you want to quote it, once you're able to last within 1 to 3 minutes, that's 180 seconds as a man doing sexual activity, that is premature ejaculation. A lot of factors could cause it, and we are going to discuss in this show what could cause it, because sometimes it might not be your fault as a man, and sometimes as a man you need a partner that will understand with you. That's why always go for a partner that you can relate with what is happening around you, because sometimes you don't really need to do more than you can do as a man in the other room. You just have to do what you can do to achieve sexual satisfaction in the other room. So we are going to discuss the major types of premature ejaculation. We have two types. Now the first one we call primary premature ejaculation, and the second one is known as the secondary premature ejaculation. Now for the primary premature ejaculation, that is well, I say it's not too common, but it's also very common, because that is the ejaculation that occurs during your very first sexual experience. Now as a man, your very first sexual activity with a lady can lead you to having premature ejaculation, and these things will continue through life, you understand, unless there is intervention. For example, now let's say we have been a man and maybe late because of maybe your church you are going to. I'm not against what you believe in your church, you understand. Now you are someone that have been following a particular lay for the past 2 years, hoping that once you guys marry, at the end of the day you can start what a man and a woman do to bring a offspring. Now at the end of the day, you have waited quietly or patiently, let me use the word patiently, for 2 years, and then your first experience with her after all these 2 years, that's almost 1 year is 365 days, and then you have another 365 days, which is 2 good years. You have waited patiently as a man for 2 good years without having any sexual activity with her, and then on your honeymoon night or whatever after your marriage, you now engage in it, and at the end of the day you lasted for just 180 seconds. That's premature ejaculation, and that will continue, you understand, that will continue persist through you guys sexual activities. So at the end of the day, that is what we know, that is what we call primary premature ejaculation. We have the secondary premature ejaculation, which is the type 2. That is the one that occurs after you have had previous sexual activity or sexual experience. There are some people that during their first sexual experience they were performing very well, as in they can be there for 30 minutes, 1 hour, as the case may be for them, you understand. I don't know how long you will last. I don't even want to discuss how long a man should last, but in this show we are discussing that anything that makes you to last for 180 seconds, that is premature ejaculation. Now for people that exhibit the secondary premature ejaculation, those are the kind of people that had these kind of issues after their first sexual experience, you understand. So but for the people that are having for the very first time after their very first sexual experience, and they're having this 180 seconds ejaculation, though that is the primary one. For people that have it after series of sexual activity, they're having it along as they grow in their sexual experience, that is what we know as the secondary premature ejaculation. Now that we have known the 2 basic types of sexual premature ejaculation, we are going to discuss what could be causing these things. You understand? There are a lot of factors that could cause premature ejaculation, and sometimes to get the best treatment you have to understand what is causing it, because you can't treat what you don't know. So as health professional, we always want you to understand the underlying cause, because sometimes it could be just a small tweak and you get back to being a man and performing your duty very well in the other room. So we are going to discuss some of the very common factors that could enhance or that could lead to premature ejaculation in the face of a man. Please don't feel ashamed, because these things are just very common. Sometimes you don't know how to express, or you don't know who to talk to. But in this show, we are going to dialogue it. We are going to bring those simple things that could be causing it. Because once you're able to know the simple things that are causing it, I can assure you that we are going to give you the right treatment, and we are going to discuss what you can do in this show for you to treat this premature ejaculation. I'm going to also talk about some home remedies. I'm going to also talk about some medications. I'm also going to talk about some lifestyle modifications that we can do to prevent premature ejaculation. So we are going to look at what could cause premature ejaculation in the life of a man. Now, number one on our list is biological factors. Now, biological factors could expose one to having premature ejaculation, which we have low level of serotonin. You understand? That's one of the most important hormone that helps in ejaculation. So once you have low level of that, you can be liable to experience premature ejaculation. We also have psychological factors. Now, these are the common. This one is very, very common. And these psychological factors we are talking about, we are looking at anxiety. Then we also look at stress. Then we also look at depression. Now, anxiety is one of those things that could expose a man to having premature ejaculation. For example, if you are someone that naturally get excited over things, or having a lady around you, you understand, you feel overwhelmed, you get, before you even have a penetration, oh guy, you are going to ejaculate. You understand? There's no two ways about that. So you have to work on your psychology. You have to always try to pull out your mind outside the game. You understand? The game is the game. You have to stick to the game, because once you are not performing your role in the game, bro, we are going to be a laughing stock. You understand? No matter how they want to sugarcoat it, they may just be around you because of what you are performing or what you are giving them. But at the end of the day, if they want to choose, always go back to someone that gives them that sexual desire. So as a man, try to manage your anxiety. You understand? Try to curtail it. Don't so much put all your mind in the game that you're about to play. Just allow your mind. You can shift your attention away from it, because once your mind is so soaked into what you're about to do, I can assure you that you're not going to be last longer than 180 seconds. So always try to take your mind, try to manage your anxiety, try to control it. The other thing is stress. Now, stress is one of those factors that could enhance a man having premature ejaculation. It could be work stress. For example, you're coming back from a very stressed work. You had a very stressed work there. Then after work, you enter traffic. You had a very long queue of traffic or traffic jam along the way. Then when you came back home, you still want to engage in sexual activity. You can't last. You understand? You can't do your work at that condition, because you're already stressed out. You understand? At that level, you cannot perform your role as a man in the other room. So you have to manage your stress. You understand? A man life cannot be, nobody can rule out stress completely, but we can manage stress. You get? So we can manage stress. Once you're able to manage your stress, you can also enhance that you last longer and you perform well in the other room, because stress could also expose a man to having premature ejaculation. The last on psychological factors is depression. Now, if you are someone that naturally depressed, you can also be having premature ejaculation. You understand? So once you are looking at these factors that could cause it, also rule out this thing. In psychological factors, we talk about anxiety, we talk about stress, then we talk about depression. So all these factors in the psychological aspect of it could expose one to having premature ejaculation. You also have to look at it. Now, another factor that could cause premature ejaculation is physical activity. Now, lack of physical activity. Now, lack of physical activity could also lead one to having premature ejaculation. So you also have to ensure that you are always mobile, or in the sense that you're always engaging in one physical activity or the other. Then we also look at the last thing that could make a man to have or to experience premature ejaculation is lifestyle. Now, the kind of life you are living as a man could expose you to having premature ejaculation. There is no two ways about that. For example, if you are someone that spend more time drinking, you understand, you want to drink like 6 to 7 bottles of beer, for instance, as the case may be, bro, you'll not be able to perform well in the other room as a man. There's no two ways about that. No matter the medications you are going to be taking, you get. So first, you have to cut down your alcohol consumption. Then someone that is into cigarette smoking, you understand, once you engage in excessive smoking, that could also expose you to having premature ejaculation. So for us to treat or to reduce the occurrence of premature ejaculation, we have to know what is causing it, because it's from what is causing it that we can know, okay, this is how we are going to treat it. Is it your lifestyle that's causing it? Is it a biological factor that's causing it? Is it physical activity that's causing it? Or is it psychological factor that's causing it? So once you're able to know what is causing premature ejaculation in your own life as a man, we are going to give you the best treatment possible, because at the end of the day, the quality of life you live could affect what is happening around you as a man. And so we are going to look at what is the effect of this premature ejaculation in the life of a man, because sometimes we don't talk about these things in the society. You can just be on your own trying to fight it on your own. But from what we have said so far, once you know what is causing it, I can tell you that you are going to treat it. So you look at the effect on the quality of the life of a man. So one of the effects is it reduces low self-esteem in a man. You know, if you are someone that have a very high esteem, like you carry yourself so high, premature ejaculation could humble you. You understand? No matter how you want to perform, or no matter how you want to sugarcoat it, that thing can make you there so low. You understand? It can reduce your morale as a man when it comes to your opposite partner. So those things affect the quality of life of a man. Another thing it does is relationship strain. Now, premature ejaculation could make you stay out of relationship. You understand? Because you be fighting, you be trying to explain. You understand? Sometimes we say you go explain that no evidence. You get? So those things are what you could cause you to abstain yourself from relationship. The last thing how it affects the quality of a man's life is withdrawal of intimacy. You know, some men out there have totally withdrawn themselves from relationship or from intimacy. You get? Because of the fear of embarrassment, fear of disappointment, and those things, unnecessary explanation. You get? There are some people that can now handle it. So if you're a man out there and you last for just 180 seconds, which is 1 to 3 minutes, do not feel embarrassed. That's why always go for a partner that you can sit down, have a round table discussion where you're able to open up yourself. Because if you can express yourself to your partner could also help you to walk through. You understand? It's a common condition. It's not untreatable. It can be treated. You understand? Once you know what is causing it. You understand? So always go out for with a partner that you can easily express how you feel, because once you're able to open up to your partner will also help you to walk through the phase of life. Because once, as a man's life, once you feel depressed, you feel embarrassed, then your morale is being reduced because of premature ejaculation. That should not make you to totally withdraw yourself from relationship or intimacy. Always engage. Always talk to your counselors as the case may be. So we have mentioned what could cause it. We have discussed what were the various types of premature ejaculation. So we are going to go straight into home remedies. What can we do at home to reduce this thing? So we are going to talk about treatment. In this treatment, I will categorize it into two classes. I'll talk about the pharmacological treatment and the non-pharmacological treatment. Now, pharmacological treatment is where we are going to talk about some medications, what you can take, you understand, some drugs you can be using at home or in your office, wherever you are, that could enhance that could reduce premature ejaculation, you understand. Then we also talk about the non-pharmacological ones, which is the one I want us to pay more attention to, because these ones are the ones you can do at home, you understand. You don't really need to go to the community pharmacy or hospital or a part-time medicine shop to procure these medications. These are what you can just do at home at a very quiet note. Nobody will know. Even if you are someone that keeps a very low profile, your partner may not even know what's going on around you. But if your partner is someone that is very smart, you understand, because of how long you have been lasting while during sexual experience or sexual activity, it might be smart to know this my guy is working to improve his or her sexual life or sexual experience. So we are going to talk about the non-pharmacological treatment model that we can use to reduce or to enhance reduce premature ejaculation at home. So number one on our list will be biological behavioral techniques. Now, behavioral techniques do old, but I can tell you that it works very well. It still works. In fact, one of the advantages of behavioral techniques is that it helps to enhance your pull out game. You know, sometimes ladies will always say the guy's pull out game is very strong. You understand? There are things that makes a man's pull out game to be very strong. It may not necessarily be fear of maybe pregnancy or anything. It could be what he has faced along his life. You understand? The growth he has experienced during his sexual experience. That could also help a man's pull-out game to be very tight and strong. So now we are going to talk about behavioral techniques. What can you do at home? You understand? Some behavioral techniques that you can do at home to reduce premature ejaculation. Number one in our list is the start and stop technique. You know, this technique is very simple to do, but first you have to have a partner that can understand with you, because first if your partner is someone that is not considerate, you understand, someone that do not feel your pain or someone that do not understand what you are going through, you might feel embarrassed along the line, you understand. No, this start and stop technique is during your sexual activity, the minute you feel the urge to ejaculate, you pull out your manhood, then you engage in foul play, then allow yourself to be in the foul play for some time. Now, during this period, the urge to ejaculate will reduce. Now, once the urge to ejaculate reduces, you can get back into the game and then continue your activity. Then another technique is a squeeze technique. Now, though this technique is very old, like I said, the behavioral techniques are generally very old, but they're still working, and these are what you can do at home to reduce premature ejaculation. Now, the squeeze technique is during your sexual activity. Once you feel the urge to ejaculate, you pull out, then you squeeze the tip of your penis. Now, you hold it for at least up to 30 seconds. Now, once you hold it up to 30 seconds, the urge to ejaculate will reduce. You understand? That anxiety that is all over you, that you want to ejaculate, that it will calm down. Now, once it calm down, you can get back into the game. So the squeeze technique, though old, but it still works. So, but at the end of the day, it relates to your partner, because these 30 seconds you are pulling out, your partner might feel discouraged, might feel embarrassed, might not feel to be interested in the sexual activity again. You understand? So that's why I say you have to talk to your partner. You understand? Go out with someone you can easily open yourself, express how you feel, express your sexual life too. You understand? Because at the end of the day, your life is your life. You understand? No matter what anybody wants, nobody can take your life away from you. So these are what you can do at home to enhance, to reduce premature ejaculation at home. So we are going straight into the number 2. Another one what we can do at home is the pelvic floor exercise. Now, I know we have heard of the Kegel exercise. That could help us to reduce premature ejaculation, because it could help to delay ejaculation in which you engage in Kegel exercise. That could also help you to reduce or delay premature ejaculation. So always engage in that exercise. You can check it out and then we try it. So another thing that we can also do at home to reduce premature ejaculation is the use of some herbal supplement. Now, there are some herbal supplement that we use that our forefathers used to use, that because of this effect they also used to also delay ejaculation, like this, the use of this ginseng. Now, that ginseng tea people drink, you understand, it is very helpful. It's very healthy when it comes to delaying ejaculation. That could also be done at home without taking medications to reduce premature ejaculation. So we are going to go straight into the pharmacological treatment. What can we take? You understand? The lifestyle. You understand? We are going to talk about drugs that we can use to enhance or to reduce premature ejaculation. Now, before using this drug, you have to always meet your healthcare professional, because they are the right place to tell you the exact dose of this drug to use. You understand? Though most of these drugs are off-label prescription. You understand? I must tell you that. You understand? What I mean by off-label, it's not as if this drug was manufactured for that. Again, it was not produced solely intended for this purpose, but it's just the off-label use of it that we could use it to delay delay ejaculation. You understand? So one of those class of drug is the SSRIs. That is the selective serotonin reuptake inhibitors. Those drugs could also be used to delay ejaculation, like the fluoxetine. All of them in those class of drug could be used to delay ejaculation. That could also help you to enhance your sexual life. Another one is the tricyclic antidepressants. So those class of drug, like the clomipramine, those could also be used to delay ejaculation. But like I said earlier, always consult your healthcare provider before using this drug. You can't just walk into the community pharmacy. These are controlled drugs. You can't just walk into the community pharmacy or patent medicine shop to procure these drugs on your own. So you have to talk to your healthcare provider, because they will be the one to tell you the exact dose of this drug to use, and then also monitor the underlying cause of these drugs, underlying treatment cost before using these drugs. So we now move straight to lifestyle modification, because this is where I likely preach to young guys out there, because sometimes what we do before now could expose us to having premature ejaculation, because your lifestyle modification is key when it comes to enhancing your sexual life. Now, so in lifestyle changes, what are we going to look at to enhance or to reduce premature ejaculation in society? So we are going to look at diet. Now, what you eat as a man could enhance your sexual function. You understand? And once your sexual function is being enhanced, it could also enhance that you perform more than 180 seconds. That means you can last longer than 1 to 3 minutes as a man. So your diet, always ensure that you are eating well, balanced diet. Encourage yourself to be taking fruits. You understand? Some vegetable, lean protein. You understand? Whole grains. Eat good food, because once you're eating healthy, it's not just you are not eating this food because of you want to enhance your sexual function, no, or sexual activity or sexual experience, no, but your overall health. What you are eating is also very key, because aside enhancing your sexual function or your thereby for you to have a good sexual experience during your intercourse or during your relationship issues, this will also help you to enhance general body health and general function of your entire health. Now, fruits, diet, vegetable, whole grains, lean protein, engage or encourage yourself to be taking those things. Those things are very, very key. Then physical activity. Now, exercise is very, very key. When exercise is also very key when it comes to enhancing a sexual function in the life of a man. So always engage in sexual, or always engage in physical activity. Hit the gym, you understand, carry weights, you know, all those things. Enroll yourself in the gymming, this thing, because then seek for a personal coach that will train you. You understand? Engage in sexual physical activity, because once you're engaging in physical activities, you could also help to enhance your sexual experience during intercourse. Because once you are obese as a man, you understand, you have your BMI is high. You understand? Once that is high, you cannot perform. There's no magic. There's nobody in your village following you. Let's not be lying to ourselves. Say, and in my village, nobody is following you from your village people. You understand? No village man is following you or anybody. It's just what you have done along the course of your life. You understand? It could be your lifetime modification. It could be your excessive use of drugs. All those things could cost it. So look at what you are eating. Engage in physical activities. You understand? Then aside that, always try to talk to a counselor. You understand? I also advise that you should have a counselor that you talk to. So for couples, there are couple therapy sessions that both of you can go meet your therapist and then you talk to. You understand? We also have sex therapists. Seek to enroll and then talk to them, because these are professionals that will counsel you. You understand? They will rule out whether it's psychological factor that is causing it. They also rule out whether it's biological factor that is causing it. Then they also rule out whether it's lifestyle modification that is causing it. You get? So always talk to your sex therapist. You understand? You get? Enroll in their class, in their sessions, either online or one-on-one, where you go, you meet them, you talk with them, you dialogue with them, because they are there to help you. They are professionals. You understand? You have nothing to worry about. Then for the couples, always, you can enroll in a couple therapy session in which you're able to talk to both of you would enroll, both of you will go there, then your wife will talk about how she feels, how she wants it. You understand? You feel, okay, my guy has been lasting for just 2 minutes, oh, my guy has been lasting. Let her express herself. You understand? You as a man, you also be there to express. You understand? This is not the time for you to be feeling that you are the man of the house. You want to be feeling so entitled to not satisfying your partner. You understand? So please always enroll, seek the counsel of professionals. You understand? Seek the advice of a professional. The sex therapist is there. Enroll in their session, either online, either one-on-one. Enroll and then get treated. You understand? Because once you talk to people that are professional in that angle, they will help you. You understand? You can't keep prescribing your drugs to yourself. You can't keep running from one place to another, buying supplement up and down without knowing what is causing it. So these professionals are there to help you. Enroll in their counsel session, then get counsel, and then adjust. You understand? Because they'll be the one to tell you, okay, it is your physical, it is your biological factor that is causing it, it is your psychological factor that is causing it, it is your lifestyle that is causing it. They will be the one to know what is causing it. And I can tell you that once they know what is causing it, treatment is very easy. You understand? Like I've mentioned earlier, or that we have talked about here, treatment is very easy. It's not something that because of you having a premature ejaculation as a man, you abstain yourself from relationship. You understand? You know, some guys out there, some of them can be up to 40 years, but they'll be like, they're very successful in the society. You understand? Don't quote me wrong. They can be very successful, but because of the fear of embarrassment, you understand, fear of disappointment, they don't want to engage in intimacy. You get? You understand? They don't want to engage in intimacy. So please, as a man, always engage with your therapist. Talk to them. Enroll in their session. Reach out to them. You understand? Then if it is your lifestyle, check your lifestyle. Because once you're able to curtail some excessive smoking, excessive drinking of alcohol, that could also help. Enroll in physical activity like the gymming session. Book. You understand? Go engage in 1 or 2 activities. Don't just be there. Then if you're obese, talk to your counselor. You understand? Get these things in place. I can assure you that once you're able to put all these things we have mentioned in place, you are going to get back on track. You understand? You are going to get fully back into the game. You understand? You are going to be lasting more than 180 seconds. Thank you very much for staying with us today in Vital Day, because all we do here is bringing health tips closer to your nearest doorstep. So if you have not subscribed, please, I want to beg you to subscribe, like, and then share to people, because what we do is just to bring health tips closer to your nearest doorstep. Always subscribe to us and then tell people about us, so that and then turn on your notification bell, so that once we drop, you'll be the first to notice and then watch and then share. Thank you for sticking around with us today. I appreciate you all. Bye.